Hi everyone, I am Lisa, owner of the Beauty Loft in Stone, and this is
Annie,
my amazing therapist, and we decided just to do a quick live video basically to explain a little bit more about IPL and how it works, answer any questions that you might have. So if anyone's watching this live, you can just ask a question in the comments and we'll try and answer it for you. And if you're watching it later on, catch up, because it will be on the news feed and on the Facebook page. Just if you have any questions, just pop a note in the comments. Hi Debbie, and we will answer your questions later. So yeah, feel free to ask a question at any point while we're talking. So I just wanted to do a little bit of a brief introduction about what qualifies us as IPL and laser therapists. So we have both completed the Core of Knowledge in Laser and Light, which is from the University of Manchester, and we've had extensive training that is provided by the manufacturer of our Linton IPL equipment, which is Linton Lasers, who are an award-winning equipment provider and training provider in the UK, and they also provide laser and IPL equipment to the NHS. So they really are the best in the business. Do you want to just quickly run through what we actually covered on the training, Annie, so that people know that we do know what we're talking about?
Yeah, so the operation of laser is properties of light, light tissue interactions, effects of light on skin and eye, selective photothermal...
Selective photothermolysis.
Oh, that's it. System operation, laser safety, and then clinical considerations, establishing a safe environment, patient consultation information, medical contraindications, pre-treatment considerations, action to be taken in the case of an adverse effect, and then hygiene, record keeping, treatment protocols, aftercare, effectiveness of treatment, and then conditions to be treated are hair removal, skin rejuvenation, acne removal, pigmentation removal, and thread veins.
So as you can see, it's really in-depth and intense, the training that we've had. So I just want to start by talking about hair removal, because that is probably the most common treatment that we do at the moment. So how does it work then? So IPL stands for intense pulse light, and what happens with hair removal is the light is attracted to the pigment in the hair. So this is why we can only treat hair that is light brown to dark. If your hair is very, very blonde or grey, then we can't unfortunately treat it with IPL. There are other laser treatments that you could have, but not that we would provide here. So that's the first thing, that the hair does need to have some pigment in it. And how it works is the heat builds up down the shaft of the hair, and when the hair is attached to what's called the dermal papilla, which is what feeds the hair, the heat actually kills that off. Therefore, there's nothing feeding the hair, and the hair will basically not continue to grow. So that's how it actually works. How the treatment is carried out is there's a device which the handpiece is basically, there would be a block fitted on here, which Annie will just get up and set up now, and that is actually applied to the skin, and you feel kind of a very quick, sharp tingle. It's not painful. I wouldn't call it painful. I would say it's
band.
Yeah, like a bit like an elastic band flicking you, and it's a moment of discomfort, let's say. It's certainly, I mean, for those of you who've had waxing, it's nowhere near, well, I mean, I don't think waxing is painful personally.
I do.
Do you?
Yeah.
Some people have better experiences with waxing than others. So if you're someone who does actually find waxing quite uncomfortable and sometimes painful, particularly in intimate areas, then it's certainly nowhere near the degree of what you would feel when you're having waxing. Would you agree?
I totally agree, yeah.
Yeah. So in terms of if you're suitable for treatment, as I said, not everyone will be suitable because of the colour of the hair. Also, if it's sort of very, very fine, peachy, fuzzy, villous hair, that wouldn't be removable with IPL. The other thing that we really do have to consider with IPL hair removal is your skin tone and therefore your skin type. So I'm not sure if any of you will be familiar with the Skin Fitzpatrick scale, but just to give you an idea, we've got a little chart here. I don't know if you'll be able to see this, but basically there are skin types 1 to 6. So skin type 1 would be your very fair skin type, your very, very white, Celtic skins, always burns, never tans, you know, your redheads perhaps, those kind of skin tones would be skin type 1. And then you've got a scale sort of going from skin type 1 to skin type 6. Now the darkest skin type that we can actually treat with IPL is a skin type 4, which is there on the chart, and if you can see that. So skin type 4 is moderately brown. It would be a skin that rarely burns and tans with ease. And examples of a skin type 4 would be Middle Eastern or fairer Asian skins. So we can actually treat most skin types with IPL for hair removal. So that's just a bit about whether or not you would be suitable for treatment. And some people ask what will happen immediately after treatment, you know, what will I see? You know, you won't suddenly have a big shed of hair, you know, a fallout of hair. It doesn't really work like that. Dead hair shed over a period of 1 to 3 weeks. So they'll continue to grow as the new epidermis grows and pushes them and forces them out. And you will get this sort of shedding of your hair. How long does each treatment take? Well, that kind of depends on the area that you're having treated. So I kind of liken it really to the length of time it takes for waxing treatments. So for example, if you're having an underarm wax, that takes about 15 minutes to have it waxed, and it takes a similar amount of time with IPL. So if you're used to having waxing, then the length of time it would take for your treatment would be similar to the length of time it takes for you to have whatever waxing treatment you usually have. In terms of side effects, so there aren't really any side effects that would be lasting long-term side effects. I mean, they're all sort of immediate short-term side effects. So you may experience a little bit of redness, you will sometimes get swollen hair follicles, and you may also get a temporary lightening or darkening of the skin, but these are all very, very temporary after effects. And we do apply cooling to the area after you've had a treatment. So we apply the Linton Light Soothe, which has ingredients in it just to sort of calm the area down and keep it nice and cool. How many treatments are necessary? Well, usually you would need a minimum of 6 treatments, and we schedule them between 4 and 6 weeks apart. The reason we have to do this, and the reason why you need so many treatments, is because the hair has to be in a particular phase of growth in order for the IPL to kill off the dermal papilla, and that's called the anagen stage of growth. And that's where the hair is still attached at the root to the dermal papilla, which is what feeds the hair. Now, there's only ever about sort of 12 to 15% of your hairs in that anagen stage of growth at any one time. So this is why you have to come back and have a course of sessions in order to make sure that we try and get as much hair as possible in that anagen stage of growth over the course of you know, the 6 months or so, 6 to 8 months that you're having treatment. So in terms of consultation, what happens at the consultation is you come into the clinic, we will ask you to fill in a consultation form. It has lots of information on there about your medical history, any medication that you may be taking, because all these things are really important and need to be taken into consideration when you're embarking on any kind of treatment really, but specifically IPL. It also gives you the opportunity to ask any questions. So if there's anything that you're still not sure of about the treatment, you know, that's your opportunity then to ask anything, you know, any concerns that you have, anything that you're not sure of, anything that you don't understand, that's your opportunity to ask, and we will make sure that you have all the information that you need before you start any kind of treatment. We also obviously have to gain your written consent to go ahead with treatment, so that is when we would do that. And also we always perform a test patch, and this is where, so for example, if you were coming in to have your underarm hair removed, we would perform a small test patch on the area under your arm, exactly where we're going to be removing the hair, just to see how your skin reacts, and you know, to make sure that we get the settings of the machine to the best possible point, to ensure that we get the best possible result for you, and that's why we need to do a test patch. Is there anything I've forgotten that you can think of about consultation or anything?
No, I don't think so.
Okay. So what I'm going to do now is Annie's going to start the machine up, and it's just really to sort of demonstrate how there's nothing really to be concerned with IPL, because the machine is set up in a way that nothing can really go wrong. We don't have to kind of think of the settings to set the machine at. It's all programmed in at your appointment. So the reason we have to sort of determine what skin type you are is because we need to make sure that the settings that we program into the machine are right for your skin type, and it means then that you're going to get the very best possible results. So every time we switch the machine on, we always have to do an output test, which Annie's just doing now. So this basically tests the machine to make sure that everything's working correctly, all the output is correct, and we're going to get the best possible results for you. Sometimes we have to do it a couple of times, maybe 2 or 3 times, to get the actual test completed, and then other times it'll just work on the first attempt, but typically, because we're live, it's taking a bit longer. Do you want me to see if I can do it?
Yeah, you can.
Yeah? So I'm just turning away from the machine just because it is actually emitting light. And when you're working with light, you do have to wear eye protection. So that's the other thing as well. When you have your treatment, you will be given dark glasses to wear, which just protects your eyes from the light. So if Annie was going to be doing hair removal on an underarm, perhaps she'd use let's do a medium block. We'll just show you a demonstration with a medium block. So there are various sizes of blocks. So this is the medium one that's on at the moment. Shall we just, can you see that? Might need to hold it a bit closer, I'll just show you. So that's the medium block, that's the size. There you go. And there's small ones, so we would use something like this if we were doing a smaller area such as the lip area, and then we have a larger block, which is this one, and that's what we would use if we were doing, say, a leg. Okay, so it just depends on the area that we're doing. And then what we will do is Annie would just program the machine for your information that you've given us. So if she was doing me, for example, I'm a skin type 2, so she'll select skin type 2. The hair, I've recently had my underarms done, so was it brown or dark brown? So my underarm hair was lovely and dark brown. and then it automatically comes up with the settings that we need to use for me, basically. Now, as we go through, and the reason we do the test patch is that we can sometimes need to adjust these settings, and we do have parameters that are set out by Linton of how much we can adjust these settings by, and that's just to ensure the efficacy of the treatment and to make sure that we get the best possible result for you. So we will constantly be asking you when we do the test patch how that feels in terms of discomfort on a scale of 1 to 10, 10 being really, painful basically and intolerable, which it would never get to that point. And we would like you to be at, say, a 6 or a 7, where it's uncomfortable but not unbearable, and that's what we aim for you to be at. The kinds of things you'll experience when you're having your treatment is, and what Annie and I get quite excited about, is when we smell hair burn. Because if we can smell that burning of hair, I don't know if you've ever smelled hair burn, we know that it's actually working and it's getting rid of the hair. And also something that I should mention as well is, shall we disable? Are we going to do a little bit of a demo on my arm, just so that people can see what it actually looks like? So if you just do the wipe and the gel, we will do a little bit of a demo on my arm, just so that you can see what actually happens. But when you come for your consultation, never wax or shave the area beforehand that you want us to review. So if you were having a lip wax, for example, you would need to come in for your consultation, not lip wax, IPL hair removal on the lip, with the hair there. The reason for this is we need to see the coarseness of the hair, we need to see the colour of the hair, and we can't do that if there's no hair there, if you've plucked or waxed or shaved. So whenever you come in for your consultation, we need to see the hair. And then when you come in for your treatment, once we've done the test patch and you've booked your we've just got a question. Is there no kind of numbing cream you could use? Okay, that's a really good question, Debbie. There isn't, and we wouldn't use numbing cream, because if we did, you wouldn't be able to tell us what you were feeling, the sensation that you were feeling, and we never want it to be more than a 7. So we'll adjust the settings very, very gradually, and we'll do one quick burst of IPL, one quick zap, and then you will say to us, oh, that feels fine. I would say I'm about a 5 or a 6, and I would say, okay, so maybe we can just notch it up 1, and we'll just increase it slightly, and then we do another one, and you'd say, oh, I felt that a bit more, that's more like a 6 or a 7, and then I know, yes, that's right where we need to be.
It's never paying for enough for numbing cream ever, is it?
No, you would never need numbing cream, because you just wouldn't feel it that much, so that's why we don't use it, and we never would need to. What was I just saying then? Oh yeah, so when you come in for your consultation, so when you come in for your consultation, once you've had your test patch and we know what settings we're going to start with, we will ask you to shave the area before you come in. And some people do feel a little bit uncomfortable with this, especially if it's sort of around the lip and chin area. But you can't pluck or wax for the reasons that I've explained earlier, in that the hair just needs to still be attached to the dermal papilla, otherwise your treatment isn't going to be successful. So that's why you can only start shaving once you've had your test patch and we've seen the hair.
I think one thing people think is that it makes the hair go back thicker when you shave, which isn't true at all, is it?
No, not at all. And there are advantages to it as well. I mean, if you're used to, say, having your bikini line waxed every 5 weeks or every 4 weeks or whatever, you've got to kind of go through that painful period of knowing that you've got hair there for, because you do need hair there to wax. So you've got to have that sort of week or so where you think, oh, I can't wait to get this done. With IPL, you don't have that issue, because you can shave throughout whilst you're having your course of treatments, so you've not got this unwanted hair there. You know, same with your legs. If you're used to having your legs waxed, you have to let them grow a couple of millimetres so that you can actually have them waxed. You don't need to do that with IPL. So I'll just pop some goggles on, and I was just going to do a little quick blast so that you can see. Hopefully you can see that. Shall we go a bit closer? It's not okay. Am I on camera still? Yeah? Oh, sorry, I put my arm down a bit. It's not better. Okay. 3, 2, 1. And that's it. And literally, it was like a split second of, oh, I can feel that, but it's not painful.
Just slightly warm.
Yeah,
as well.
yeah. So don't let that put you off, because it really isn't painful. And when we did your test patch, we would ensure that we've got the settings at the right level. So don't ever worry about that. It's not going to be an issue. So that's a little bit about hair removal and how it works. And I just wanted to talk about why now, coming into autumn, is such an ideal time to start a course of hair removal treatments. And that's because, as I've said, you usually need at least 6 sessions. And if you're having them every 4 to 6 weeks, then you're talking at least 6 months. So if you want to be hair free for next summer, spring, summer next year, then autumn is a great time to start your treatments, because you will be hair free for next summer or spring, depending upon when in the autumn you start your treatments. That's one good reason. The other good reason is that when you're having a course of hair removal treatments or any kind of IPL, you do have to avoid UV exposure. So we can't treat you if you have a tan skin. So if you've been on holiday, and say you're in the middle of having a course of IPL on your bikini line, and you've been wearing a swimming costume and you've been sunbathing and you've got a tan around that area, we can't do your treatment. So you must be completely free of any kind of tan. And also when you're going through your course of treatments, you need to be really diligent with SPF on the area. So this is more relevant if you're having any facial areas done, so lip and chin for example. UV is there all year round. I'm not just talking about the UVB, which is the sun. I'm talking about the UVA rays, which are there all year round, whether it's raining, cloudy, whatever. They're there all the time, and you need to avoid exposure to all UV. So you wouldn't really need to be diligent with SPF if you're having any kind of IPL treatment on your face or anywhere that's exposed to the sun. So if you're having it on your legs, this is another good reason why it's best in autumn, because you don't tend to have your legs out so much because it's not as warm. So you're covered up, aren't you, in the autumn and winter? So that's a really good time to start your IPL. So if there's nobody who's got any other questions, I'm not going to go into detail particularly now about the skin side of IPL, because I've already been talking for nearly half an hour and I didn't really want this to be a really lengthy video. So I'll perhaps put another session on where I will go more in depth about the IPL and how we can treat certain skin conditions with it. I'll do that as a separate clinic, so that those who are interested in the skin side of things can see and hear more about that. What I will say is, just to give you a little teaser, well, first off, we're doing free IPL hair removal consultations throughout September. That's again because autumn's the best time to start. So you can book those online. And I know that usually when you book online you have to pay a deposit, but if you use the promo code IPLSEPT, all capitals, it will give you a free consultation. It will just basically deduct the £25, which is what the consultation fee usually is. So you can come in. If if it's something you've been thinking about but you're not sure, you can come in. It's not going to cost you anything other than 40 minutes of your time to come in and have a chat and ask any questions that you've got, and we can do your test patch. So that's free throughout September. Not much of September left though, so if you're wanting that, you need to get booked in quite quickly. I'll put a link and the promo code as well on the comments after I finish the video. And the other thing I wanted to say, I'm not going to reveal what these actually are, but when the official start of autumn comes around, which Google tells me is the 22nd of September, that's the first day of autumn, we are going, did you know that?
No, I didn't.
We are going to release some very special hair removal deals because we want you to be hair free for your next holiday next year, so that you don't have to worry about shaving those legs, shaving those armpits and that bikini line. So yeah, we've got some really good specials on certain areas which are the most popular areas for hair removal. So have a look on your emails and your keep tracking on social media, because we're going to be announcing what those deals are on the 22nd of September. All right, anything else?
No.
Okay.
I don't think so.
So it's bye from me and
Bye from me.
and thank you for watching. Any questions, pop them in the comments if you're watching this after, and we'll answer them for you. Have a good day. See you soon. Bye.